My name is Annie Hill, Anniehil. I'm a registered nurse. I have an associate science degree in nursing, and 37 years after my associate science degree, I went back to school and I obtained my bachelor of science degree in nursing. For Emory University Hospital of Atlanta, Georgia, I am a unit charge nurse / registered nurse. At this time, I do plan on staying in nursing. I really enjoy having the opportunity to serve and to care for people. So at this time, I do plan on staying in nursing. I have been nursing, working in the healthcare field for almost 40 years, come June of 2020. And I plan to retire in the near future, within the next 5 years. When I started as a clinical nurse with no experience actually except for school, I have been again working for 38 years as a registered nurse. So I've been under the leadership and training of many other people. And I have seen myself grow from a clinical nurse again to a unit charge nurse, which I initially had no desire to move up. I was comfortable doing just what I was doing, working at the bedside. But now on my job, I wear many hats. I am the unit charge nurse again over the night shift, which is from 7P to 7A on my unit. And I also serve on several different committee councils as chairperson, so I do serve in a leadership role in my job capacity. Yes, as I was saying before, technology has been a major advancement in the medical field. Another way is that, again, we do all of our documentation in the electronic record now. And for the nurses, for the secretaries, for the physicians, we all do our documentation in the electronic medical record or the computer. So it's easy for other healthcare workers to have access to patient information versus back in the day when we had to just go to that particular office or whatever and pick up the paper records and read through it. So you can scan through it quicker now. You can access it quicker. So there have been a lot of positive attributes to the electronic medical record and to technology. Also, not just the computer, but with the phones. When we used to have the phones at the desk, we now have the cell phones or hand-free phones that we can carry around with us, and so people have better access to us, and the patients and health care workers have quicker access to us. So working as a registered nurse, I am a professional, but in saying that, it's also a job. I try not to look at it as a job. I try to look at it as a professional career. So being that it is a job, jobs do become frustrating at some times. There's usually not everything that you need. You don't have enough people working. You don't have the equipment that you need at the time. So there are things that could make your job frustrating. What helps me to get through it is to remember why I am there. So my purpose for being in healthcare and working is to make sure that my patients are safe. So when things are becoming frustrating, I have to readjust, and I have to remember my purpose for being there, and it's to make sure that my patients are safe and that they have a good outcome. So when you say ideal, I'm not quite sure what that means. For me, I have to remember that in healthcare, we have to take care of the patient as a whole. So when I say as a whole, we have to know that a patient may come in with a diagnosis, but then they may have multiple diagnoses. Also, people come in, they're not going to be one way or another. So people come in with different personalities, they come in with different diagnoses. So we have to take care of the whole patient. So taking that under consideration, when you say ideal, so if someone has something that's going on, we have to figure out why is they're acting the way they are acting. I mean, it could be the cause of their diagnosis. So you have to get down to the bottom line, figure out what's going on with them, and still you have to treat them as people. So we cannot forget that these are people that we're taking care of. They're human beings, and we have to treat them as such. So it's not about me when I'm taking care of a patient. It's about the patient. What can I do to make that patient better? And so whether it's something that's going on medically, whether it's something that's going on mentally, whatever it is, you know, I have to figure out what it is that I can do to make that patient better, and again, that patient will have a good healthcare outcome. There is advice that I can share, and that advice would be the same that I would probably give to anybody applying for any job. So when you go to work, you have to go to work or go to your job, your profession, whatever it is. You just have to go in like you don't know anything. Learn as much as you can when you get there. And then put what you know and what you learn together and try to make it a great experience for in healthcare, definitely for the patient. Also, you have to remember the people that you are working with. So you got to be able to work with your co-workers, work with the people around you, and also you got to love what you're doing. So the biggest thing for me is to have a passion for whatever you're doing. So if you have